Welcome to True Vine Talks with Rachel and Linda. We hope you guys are having a good day. We know the weather is not cooperating for us yet, but it will be. Tomorrow it's going to be 80, I think. So,
Ooh, yay. I didn't know.
yay. So, today we're going to talk about, for our listeners, because this is the Mental Health Month, Awareness Month, the month of May, is myths of mental health conditions.
Yeah. Some of
Yeah.
those stigmas or misconceptions that people have around mental health. Yeah. And so one of them is that mental health conditions are uncommon and rare. Not many people suffer from mental health conditions.
Whew. Yeah.
Big myth.
Yeah.
And I think the current statistic is for the US that like 1 in 5 people will experience a mental health condition at some point in their life. So if you're in a room with 5 people, chances are at least one of them has had a mental health condition.
Makes sense. So it isn't uncommon.
Yeah, it's actually very common.
Yes. Very much so. I mean, a lot of people suffer with anxiety and depression. They're just not always feeling comfortable sharing that because of the leftover stigma, which we're getting rid of that.
Yeah.
So,
Uh,
yes.
Another really common myth is that it's always the result of bad parenting. Yeah.
You want me to talk about that?
Please do.
All right. I love to blame my parents. It's great, you know? Oh, it's their fault that I'm the way I am, right? I love to blame my parents. That's a easy thing to do. However, psychologist the Cloud and Townsend wrote in the Boundaries with Teens in the book Boundaries with Kids that 70% of how your child turns out is their own DNA, personality, and life choices. The other 30% is how you molded and shaped them as a parent. Now, I have people argue with me about that statistic. And hey, maybe you want to take 50% ownership as the parent. I don't. So, yeah, I mean, your DNA, your brain chemistry, you could got that from your great great grandpa. That's not a parenting issue.
Yeah. And think about veterans that have been in war and they come back and they have PTSD. That's not their parents' fault. It was a life event. Sometimes a life event's like a serious car accident or an unexpected loss of a close family member or friend, or even just watching the news nowadays and seeing like all of the bad, negative, hectic chaos that happens all over the world. These are all things that can amp up anxiety, depression, you name it.
Mm-hmm. And good point, Rachel. And right now, we all are having acute stress disorder due to COVID and the pandemic. So long after this is over, if you lived during this time and you were aware of what was happening, you will have PTSD.
Yep.
So that myth that, it's rare, well, it's definitely not rare right now to be struggling. So emotionally, mentally. So, yeah.
Bullying for kids is another thing that can have a huge impact on mental health. That's not a parent's fault. Being bullied in school.
Yeah. Yeah,
Right.
that is a huge, being bullied in school can make you feel like the dung of the earth, like you're just like worthless. Um, I've been bullied in school and it wasn't a fun experience for me. The shoes I was wearing was not the appropriate shoes. So when I was little, I'm giving my age away, Keds were a thing, not Dodds. I had Dodds. I had the generic version of Keds because we could not afford name brand clothes. That's okay. But I didn't know any different until a kid brought that to my attention. And that stuck with me. And I felt inadequate and I felt poor and like I wasn't good enough. So bullying can cause some insecurity and self-image issues. Your parents didn't have anything to do with that. Oh, yeah, good point, Rachel. I hope that's okay for me to share. Hey,
Appreciate, yeah,
yeah, helpful for people to hear.
very, yeah. So as we go through this list, you'll see how contradictory some of these myths are, right? So we just talked about how everyone wants to blame the parents. And then sometimes people say, oh, it's your own fault. It's some type of like personal flaw or weakness that this person has. They're too fragile and delicate. They can't handle stress, right? They blame the individual.
Yeah. The worst thing you can say to someone is, oh, you're just so sensitive. Oof, how does that land on that person?
Not well. Dismissive, like, oh, okay, I must be overreacting. Like other people aren't feeling what I'm feeling. It's not safe to share this.
Yeah, I shouldn't feel scared while in a in a on a or in an elevator with people and their germs. Well, everyone's saying something different now, right?
Yeah. Yeah.
So what you're experiencing, oh, you're just being too sensitive or hyper vigilant. Well, maybe you weren't being. Maybe those things were really there and no one was paying attention. And maybe you were more amped up about it. Yeah, like you had more anxiety about it than others did. And so that didn't mean that you were less than that person because you were experiencing something different than they did in that
Right.
moment. Yeah,
Right.
that goes
So
back
it's
to what you said last week, right? You said it so well. You said, well, if you're comfortable going without a mask, then that's okay. And then if you're more comfortable going to the store with a mask, then that's okay. Is that how you said it? Maybe I've got it wrong.
yeah, something like that. Yeah.
Yeah, something like that.
I don't remember saying it. Yeah. I think blaming the person creates a lot of shame for people because no one wants to have, struggle with their mental health.
Mm-mm.
No one would choose that. When you blame someone and, make it all their fault and their responsibility, you're saying like, try harder, get over it.
Mm-hmm. Here's a good one. And I, I love my church and I love God very much so. But when people look at you and say, well, you didn't pray hard enough or you don't have enough faith, how does that make you feel?
Yeah, terrible, right?
You should
If
pray that
someone,
day.
if someone fell down hard and they broke their leg, we would never leave them laying on the ground with a broken leg and say, it's going to be okay. Just think positive and pray about it. And then just walk away and leave them laying there. We would pick them up, call an ambulance, right? And we're going to pray in the ambulance on the way to the hospital, right? We're not saying don't pray at all. Prayer is very helpful, and positive
Mm-hmm.
thoughts are very helpful. But there are also other steps that need to be taken to achieve the end goal that we want.
Yeah. Well stated, Rachel. Yes, you wouldn't leave someone with a broken leg laying on the floor. Someone's, and I was reading Job today, and his three friends, when he lost all he had, he lost all his children, lost all of his belongings, and his three friends come and they sat with him for 7 days to grieve in his sad. Well, they had it right till they started talking to him and pointing a finger at something. You did something wrong. That's why God's taking everything from you. This is why you're sad. This is why you're miserable. So they had it right till they spoke. And sometimes we just need to sit with people in their sad and in their grief, rather than judging them or accusing them. We don't have a right to be sad, Job. It's something you did. He didn't do anything. He was blameless. I mean, that's the way it reads. So I love that book, and that there's a lot of psychology in there about not being quick to judge people about their situation or their experience.
Mm-hmm. Yeah. I think that goes along with, all of this stigma makes people view mental health like it's different from serious medical conditions.
Mm-hmm.
Right? Like mental health is just as important as physical health.
Oh, yeah.
And it takes just as much of a toll on people as someone who has heart disease, someone who's fighting cancer.
Yeah, absolutely. You're right. And chronic anxiety causes headaches, it causes stomach aches, irritable bowel syndrome. I mean, anxiety can just wreak havoc on your immune system. So those, feeling on edge and irritability can affect all of you. So, yeah.
Yeah. So when we tell people, oh, it's all in your head, it's a state of mind, there's nothing to be sad about. Stop worrying, you worry too much. What that person is hearing you say is, my feelings don't matter. You are blaming me. It's my fault.
Yeah. Which does that ever heal someone? Does that ever make them feel better?
No. Yeah, never in the history of ever has someone stopped worrying because you said, don't worry about it.
Yeah, exactly.
Yeah.
Yeah. Get over it. Like that commercial with the Marine as the therapist, get over it, throwing the tissues at the client. Yeah.
Another thing that people believe is that it's fake. Like people don't actually feel the way that they're describing, that they're trying to get attention.
Yeah.
So I'm going to say again, no one chooses to have a mental health condition. They're not doing it for attention.
No. Yeah. I mean, people would love to wake up and feel vibrant, motivated, ready to go, embrace the day, smile on their face. Who wouldn't want to feel that way? They don't wake up.
Go ahead.
Go ahead.
Oh, I was just going to say, they wish they could just get over it and move on and not have anything to be sad about or stop worrying. It's just not that easy.
Yeah. Exactly. You're right. That's so true. So we have to be very patient and kind and compassionate towards ourselves when we're not feeling great, and towards others when they're not feeling great. You don't always feel great. Right? I mean,
Yeah.
some people are like, oh, you gotta be happy all the time. I'm like, no, no, no.
Yeah. Yeah. Need to be supportive and compassionate. And I like to think of for any gardeners or plant people out there, if you have a plant in your house and it's like it's wilting, it's turning brown, it's not doing well, you're not going to stand there and go, you're not trying hard enough. Come on, get it together. You're going to be like, oh my gosh, maybe it needs some more water. Maybe it needs some sunlight. Maybe I need to take it out of this environment and put it in a bigger pot. Maybe it needs some soil with some more nutrients, some miracle grow. Right? We're gonna try to change the environment. We're not gonna blame the plant.
Exactly.
So people are basically just like higher functioning plants. We need nutrients, we need sunlight, we need water, and we need a good environment where we can grow.
Mm-hmm. And we need someone to be there for us, no matter what.
Yeah.
Yeah. Being our secure attachment for sure. I'm looking at my phone if I'm looking down to because we put it on our phone. Miss
Yeah.
Rachel did. So yeah. Can never be cured or not a real medical issue, though, one we're on.
Yeah, we talked about how people look at it as not a real medical issue, and people also think that it can't be cured ever. If you have depression, you have it for the rest of your life, or if you have anxiety, you have it for the rest of your life.
Yeah.
So, not
So
always true.
Yeah. So there are, depressive disorders that can be chronic. Some people will battle, they'll have, those mixed episodes. In bipolar disorder, that one, they'll experience depression and highs and lows too. They cycle. But you can manage those symptoms with therapy and medication. And then
You
there's
don't have to be miserable for the rest of your life, right?
Exactly. Yeah. And that's why we're here. And that's why the psychiatrists and now medical physicians can prescribe antidepressants and anti-anxiety medicine if your brain is more wired that way. Oh, yes. Can I share on here a picture of Dr. Eggman's work on the healthy
Yes,
brain?
please do. Yeah.
Yeah, let's see if it'll let me share without being the host. I think it does. Here we go. Is it popping up?
I don't see it yet. Here it is. It's up here now. Awesome.
Yeah. So I love Dr. Eggman's stuff. He wrote several books on ADD and depression and anxiety, and he does SPECT scans of the brain to show you what the brain looks like. So a normal scan, as you can see right here, is as a healthy brain, but then the overactive limbic and cingulate parts of the brain, that's where the brain is not functioning as well and could use some medication. And I think with the ADD brain, this part, the frontal lobe, is overactive. And then I think the overactive limbic system is when you're depressed and anxious. I believe that's how he described it. So there are visuals of what that looks like. And this is a helpful tool to show your clients or to show our listeners, this is a real scan of a healthy brain versus one that's maybe struggling with depression or anxiety.
Yeah.
Yeah. I'll stop sharing now.
I always love a visual picture. I know I find that helpful.
Yeah. And so, when people are feeling insecure about having these things, I'm like, well, your brain doesn't look like the normal brain would look, Now, you want to go pay to have a SPECT scan, you can. That might be helpful to see for the, the perfect, treatment plan, because then it shows you the areas that you're lit up and where you're not. So his stuff's good, Dr. Eggman. Yeah, and you can check out his website as well on there.
Yeah. So the flip side of that, one of those contradictory stigmas. So we just talked about how some people think that mental health conditions can never be cured. And some people think, well, if you feel better, you must be cured. It must be completely gone. You're good to go. Mm-hmm. Why is that not true?
Yeah. Well, like when, I know some people that have cancer that's in remission. Well, they still take chemo pill every day. How come they're doing that?
They're on a regimented plan.
Yeah.
You got to follow through.
Yeah. So seeking out therapy for a lifetime, that's necessary. That's okay. If seeking medication management for a lifetime is necessary, guess what? That's okay.
Yep.
Yeah. And Dr. Kadapali talked about that. I mean, there are going to be, some side effects to those things, just like there are to chemo.
Yeah. It's a real medical condition.
It is. The brain.
They keep saying.
Yeah, the brain shows that people with bipolar and depression and anxiety looks very different than people that do not. Yeah. Oh yeah, the last one, the myth that people are crazy, violent, and dangerous if they have a mental illness. This is so not true. Wow, Abraham Lincoln was one of the most depressed people in history. He was a very depressed man. He lost.
Look at all the good that he accomplished.
Yeah, and through his depression, he had compassion for others, and his SAD made him a more empathic individual. And he wasn't crazy. He brought about some great things, of course. The abolishment of slavery. So, some other famous people that have suffered with anxiety and depression. Kanye West said that he has, he suffers as well. There's lots of great people, and they're high functioning, and they are creative, and they're good at performing and doing lots of great things, but they struggle too.
Mm-hmm.
Yeah.
Yeah, there are people who struggle with, to maintain good mental health are often, like you said, extremely empathetic to others, compassionate, because they've been there and they know what it's like.
Yeah.
And it makes them very kind and generous.
Yeah, very much so. So yeah, the stigma that they're not. I mean, I think Gandhi was sad and depressed too. I think in and what I've read, he would get sad. So I mean, just people are, that struggle. They have a lot of insight, and I think of King Solomon in the book of Ecclesiastes, the most depressed man ever, and he had a lot of wisdom, and he wasn't violent. Everybody from across the lands came to him for wisdom. So, yeah, the stigma that they're violent is not accurate at all.
Yeah. Right.
That's not to say
not broadly for every single person, right?
Right.
This is what we're talking about. Like an umbrella. Yeah. You can't put that umbrella over all mental health conditions and say,
Thank you. Yeah.
Yeah.
There's always an outlier.
Right. Yeah. But in, from research, my interpretation is that, like, the people who are struggling with mental health, who become violent and dangerous typically have co-occurring disorders, like they also may abuse substances, right, which leads them to have lower impulse control. They're doing things that they wouldn't normally do because they're under the influence.
Yeah, that makes sense, definitely.
Or serious trauma,
Yeah.
which kind of keeps them in fight flight mode, like all the time. They're ready to fight because they feel like they're in danger, right? So a lot of times the small amount of the population that is violent is explainable and it's treatable.
Very well said. Yes, that's so true. So I hope that, did we cover it all, Rachel? Have we covered all of our myths?
I think we have covered most of them. I think the only one that we skipped is you don't need therapy, a pill can fix it. I hear that one.
Rolling my eyes. Yeah. Well, I have lots of thoughts on that. What are your thoughts?
Yeah. I think, like we said earlier, if you talk to a psychiatrist and you get a prescription for medication and it's helpful, that's wonderful. But I think that therapy is really important to incorporate along with your medication, right? Because otherwise it's almost like a Band-Aid, right? Like the medication is helping you kind of maintain stability, but you're never dealing with the root of the problem.
And that's typically attachment injuries from childhood, unresolved trauma, and, yeah, those two things. Those are the two things that come up for me in counseling with working with people, is that there's some unresolved stuff, unfinished business, and counseling is awesome for helping with those things.
Yeah, if you never talk about and work on, your deep feeling of inadequacy, you're going to continue to feel sad and not good enough.
And that can affect your work life, your career,
your relationships. Well.
Yeah. So every time I interact with my co-worker and I'm feeling inadequate, that's going to change how I experience my day, my work. Yeah. The way I perceive you perceiving me. Yeah.
Yeah.
And it's important because it changes how we do life, really.
Mm-hmm. Yeah.
And
so yes, medication can help. I keep cutting you off. I'm so sorry. I wish we were in person.
I know. We have such good energy, Rachel and I. Yeah.
Please continue.
Yes, I was just going to say, most people will say they want to have meaning and purpose in their life and to live a purpose-filled life and a meaningful life.
Mm-hmm.
And to that I say, seek counseling. And if that's not with True Vine, that's okay. Yeah. However, personal growth will help in every area of your life, just like exercise does.
Mm-hmm.
So dealing with those feelings of inadequacy and where that comes from, and start feeling better about you and accepting yourself, will impact your life at work and your career, your interactions with your significant other, your family. Yeah, counseling's good for the overall person.
Yeah, you will begin to learn things about yourself that you didn't know before.
Because we have, what do we have, Rachel? Those, we talked about it earlier, there's a lot of, we call them, blocks. Yes, thank you. Blocks. We have a lot of blocks, and I can't see my blocks. I'm blind to my inadequacies because I think I'm great. So sometimes I have to, Charlie lets me know I'm not great. So, I need someone to say, hey, you know what? You're not seeing that you do that. You didn't even see that how you pushed that person away just now. You
Yeah,
don't know that you're doing that sometimes. You can't see yourself the way you
right.
see you. That's why counseling's good.
Yeah. Yeah. And then once you build that self-awareness, like, oh, okay, I do that. Like, yeah, what's that about? You figure out the why. Oh, okay, I do this because this happened and that made me feel this way, and that stuck with me.
Yeah.
Pieces of the puzzle come together and everything begins to make sense.
Yeah. So if my unmet need with you, Rachel, is for you to say, good job. Thank you, Linda. And instead I go eat a bunch of cookies because you didn't tell me I did a good job. Well, I'm just using that as a soothing agent to sugar, or say I use drugs, which I don't use drugs. Okay, but if I use something else to soothe me, rather I should say, hey, I need to hear that you like what I'm doing for you. That's my unmet need with you, Rachel. Then I won't have to resort to cookies. No, that's a silly, but where you get the gist. I'm sure our listeners get what I'm saying.
Yeah. Yeah. Learning to know what your unmet need is, and that it's okay to ask for that, and that doesn't mean that you're needy or dramatic or a burden. It's a normal human need, right? And that helps me out if we're doing, family and relationship stuff in counseling. It helps me out because now I don't have to guess or try to read your mind. I know that you need me to give you some positive affirmation. I'm like, yeah, I can do that. Linda, you're great. You're so helpful. Thank you.
See how that's my love language, words of affirmation. So see how that lands? Yeah. You guys can see us now. So yeah, that landed on me with warmth and comfort because that's what I needed from Rachel. Rachel says that all the time. She does a good job at that, meeting that need. I'm just saying, if I couldn't even share with her what I needed, she would know.
Right.
Yeah.
So be kind and supportive to the people in your life who may be struggling with their mental health. I hope that this was helpful, and I hope it helped to kind of knock down some of that stigma.
Yeah, good topic, Rachel. And I hope our listeners and viewers gain something from this today. We appreciate you. And if you need to reach us, give us a call or go to our website, truevinewestvirginia.com, and fill out a form, and we'll get back in contact with you to see you for counseling. Thank you for joining us. Bye.
Bye.